Welcome to Medicare for All Explained. This podcast will enlighten our listeners and dispel the distortions that surround Medicare for All. Medicare for All Explained is produced in collaboration with Physicians for a National Health Program and is hosted and produced by Joe Sparks. I'm your host, Joe Sparks. This is episode 111. We don't need Medicare Advantage. In my last episode, I said that we need to get rid of health insurance companies. In this episode, I explain why we need to get rid of Medicare Advantage, and the evidence comes from an unexpected source, the Medicare Payment Advisory Commission, also known as MedPac. MedPac is an independent government agency that advises Congress on Medicare. MedPac states, quote, "We estimate that Medicare spends approximately 22% more for Medicare Advantage enrollees than it would spend if those beneficiaries were enrolled in fee-for-service Medicare, a difference that translates into a projected $83 billion in 2024, end quote. Fee-for-service Medicare is traditional Medicare. MedPac states, quote, "We estimate that Medicare spends approximately 22% more for Medicare Advantage enrollees than it would spend if those beneficiaries were enrolled in FFS Medicare, a difference that translates into a projected $83 billion in 2024, end quote. FFS is fee-for-service Medicare, which is traditional Medicare. So Medicare Advantage will cost an estimated extra $83 billion more in 2024 than the traditional Medicare fee-for-service model. And it's not because Medicare Advantage has sicker patients. MedPac adjusted for that, and Medicare Advantage still costs 22% more. That $83 billion is nearly 10% of the entire Medicare budget. And that $83 billion is more than twice as much as it would cost to provide free dental, hearing, and vision care to all Medicare beneficiaries in traditional Medicare and the beneficiaries in the private Medicare Advantage plans if they switched over to traditional Medicare. MedPac also makes a point of saying the private plans have never saved money. Quote, "Our review of private plan payments suggests that over a 39-year history, the many iterations of full risk contracting with private plans have never yielded aggregate savings for the Medicare program." Throughout the history of Medicare managed care, the program, that is Medicare Advantage, has paid more than it would have paid if beneficiaries had been in fee-for-service Medicare, end quote. Again, fee-for-service Medicare is traditional Medicare. And as I have discussed in previous episodes, Medicare Advantage plans often deny needed care. So the private Medicare Advantage plans cost substantially more money than traditional Medicare and deny needed care. In addition, these plans have not ever saved money in their 39-year history. These plans also raise the premiums for traditional Medicare participants since the Medicare Advantage plans raise the overall cost of Medicare. It makes no sense to continue Medicare Advantage under these conditions. It also illustrates another important point. The traditional single-payer Medicare system, and yes, traditional Medicare is a single-payer system, is more cost-efficient than the private health insurance plans of Medicare Advantage. That is a lesson for the entire U.S. healthcare system. Thank you for listening. You have been listening to Medicare for All Explained. Remember to tell your family, friends, and colleagues about this podcast. Information about Medicare for All Explained can be found at our website, medicareforallexplained.org. The music for this show is Super Bubbly by Jesse Spillane. The logo was created by Lily Sparks. Thank you for listening.